everyone. This is Dr. Mamta Dighe, Director Zenith Advanced Fertility Center, Pune. Which are the fibroids that we need to remove or need surgical treatment and removal before planning a pregnancy? So, if you have a fibroid which is present inside the cavity of the uterus, right? This fibroid will affect pregnancy because it is taking up the cavity, and it will also cause changes in the chemicals or the genes that are important for implantation of the embryo. If you have a fibroid which is indenting the cavity, right, and it is pushing this cavity in some way, again this fibroid may need to be removed. If you have a fibroid which is partially present in the cavity, partially present in the muscle layer, such a fibroid may also need removal. If you have a very large fibroid in the muscle layer, which is again indenting the cavity, such a fibroid may also need removal. Suppose if you have a fibroid which is kind of, present over here, large in size, and which is affecting, it could be affecting the passage of the egg and the sperm. Such fibroids, if they are large in size, we may have to consider removal. But there are certain fibroids where you do not really have to touch these fibroids at all. So if you have a fibroid in the muscle layer away from the lining of the uterus, if you have a fibroid completely on the external surface of the uterus, again you do not need to remove it. So if you have, these are called subserous fibroids, so which are on the external surface. So if you have subserous fibroids which are 7 or less centimeters, we refrain from removing these fibroids. If you have intramural fibroids which are not very large, again they do not need to be removed. Now, however, patient needs to be counseled well about the issues that may sometimes arise if we continue leaving this fibroid behind. But if you have fibroids which are present inside the cavity, which are known as submucous fibroids, or you have fibroids which are indenting the cavity, whether they are part submucous, part intramural, or even if they are completely present in the muscle layer but they are indenting the cavity of the uterus, that is the time that you must consider removal of these fibroids. However, there's one line which I like to tell everybody, and that is that there's no one size fitting all. So please be aware that the fertility consultant is the right person to decide whether you need to remove your fibroids. Are they affecting your fertility? When is it that you may have to consider removal of fibroids? Can we leave these fibroids behind but maybe use some medications to decrease the effect of this fibroid on the implantation of the embryo if you're doing an IVF? Like, for example, if you're planning to do an embryo transfer and you have fibroids which are not really distorting the cavity so much, we can consider medications like GnRH analogs or GnRH agonists, which will kind of try to decrease the effect. There can be some shrinkage of the size of these fibroids at times, but at least it will try and prevent some of the effects of these fibroids on implantation. So there are times when sometimes we do not need to remove the fibroids and try and use some medications prior to putting the embryos inside. So these are the multiple ways in which fibroids can affect fertility. These are the types of fibroids that a woman can have present in her uterus, and ultimately these are the reasons, or I have tried to specify very clearly based on the fibroid size and location which fibroids need to be removed. Now, of course, if there are a lot of symptoms like menorrhagia, extreme dysmenorrhea, then under such cases, for symptomatic relief, fibroids need to be removed. Remember one thing, we're not just looking at treatment of infertility. We're looking at having a healthy term baby. That is making sure that there is not early delivery, etc. Fibroids, if left behind, at times can lead to decreased implantation of the embryo, early miscarriage, bleeding during pregnancy, preterm delivery, and some placental problems as well. So, it is not only important to understand its effect on fertility, but also make sure that these fibroids will not cause any complications during your pregnancy. This is a little bit on fibroids and infertility and the effects of fibroids. If you have any questions, please do write to us. Follow us on our handles, which is YouTube, Facebook, Instagram, Twitter. Thank you so much for being with us.